Good morning, everyone. This is the report on the topic evaluating a health education plan. First is evaluation. Evaluation in nursing education is like checking how well teaching methods are working. It's about making sure that what students learn in school helps them take care of patients better. When teaching is effective, it means that nurses can do their job well, which can make patients healthier and even save money for hospitals. So, evaluation in nursing education is like making sure that students learn what they need to help patients as best as possible. Next is evaluation in nursing involves assessing the effectiveness of teaching and training activities. It's not a one off task, but a continuous process. By regularly evaluating these activities, nurses can make informed decisions about teaching methods, educational programs, and patient care. Essentially, it's about consistently checking if things are working well and making adjustments as needed. The key concepts are determining the focus, designing, conducting, analyzing, and reporting results of the evaluation. And the ultimate goal is to use these findings to improve or to guide future educational interventions. Next is the evidence based practice and the practice based evidence. First, what is evidence based practice? It involves integrating the best available evidence from research, clinical expertise, and patient preferences to inform healthcare decisions and improve patient outcomes. For instance, when assessing a patient with impaired mobility, the nurse might refer to Nanda International Book to select appropriate interventions supported by research to promote mobility and prevent complications. Next is the practice based evidence. It refers to data collected during routine patient care and treatment. It complements evidence based practice by providing real world insights into intervention effectiveness and guiding decision making in clinical settings. For example, patients who receive regular education on managing chronic conditions have fewer hospital readmissions, suggesting the effectiveness of patient education in reducing healthcare use. The first and most crucial step in planning an evaluation is to determine its focus, which guides all subsequent steps. The evaluation focus encompasses five components, which are audience, purpose, questions, scope, and resources. To identify these components, questions such as who the evaluation is for, its purpose, the key questions to be answered, the scope of the evaluation, and the available resources need to be addressed. The next reporters will explain this later on. Clarity and specificity in the evaluation focus are essential for generating useful and accurate results because they provide direction, guide decision making, foster stakeholder engagement, and ensure relevance and credibility in evaluation outcomes.
Next is the determining the focus of evaluation. There are five components that encompasses this. These are the audience. The audience of an evaluation comprises the individuals or groups whom the evaluation is conducted. There are primary and general audience, with the primary audience typically being those who requested evaluation or will directly use its results, while general audience include anyone who might benefit from the evaluation findings. So here, audience is essential because these are the individuals or groups that would conduct the evaluation. There are two types, the primary and the general. With the primary audience, those who requested or directly will use its results, while the general audience are those who might benefit from the evaluation findings. Then next is the purpose. The purpose of the evaluation is to clarify why it is being conducted, such as deciding whether to continue a specific education program or determining the effectiveness of teaching. it is important to distinguish between the purpose and what or who is being evaluated. For instance, in patient education, evaluations can focus on the learner, teacher, or educational activity, each serving different purpose. Keeping the purpose singular and aligned with the audience help avoid trying to accomplish too much in one evaluation. However, program evaluations may have broader scopes, simultaneously assessing learners, teachers, and educational offerings. So sa purpose, sabi niya na ang purpose, ito yung nag-clarify kung bakit ginakonduct yung evaluation. Because to know kung para malaman ng iba kung bakit ginakonduct at kung alam nila, they might cooperate easily. Then next is, sabi din dito na it is important to distinguish between the purpose, kung ano yung purpose ng evaluation, and kung sino ang gina-evaluate. Then sabi din na keeping the purpose singular and aligned with the audience. So, kailangan na ang purpose ng iyong evaluation is straight to the point and naka-align siya kung saan ang interest ng audience mo. Then next is ang questions. The questions asked in an evaluation must directly align with its purpose, be specific and measurable. Examples include inquiries about patient satisfaction with the cardiac discharge teaching program or the frequency of staff nurses' use of diabetes teaching reference material. Formulating clear and appropriate questions is essential for selecting the evaluation design and analyzing collected data effectively. So here's a question is, dito malalaman kung ano yung kailangan or kung ano yung essential sa paggawa ng evaluation design. Then dito din malalaman kung or dito din nakasalalay yung pag-analyze nung mako-collect na data effectively. Then next is ang scope. The scope of an evaluation determines the extent of what is examined, considering factors such as the number of aspects being evaluated, the individuals or groups involved, and the time frame. It addresses questions like whether the evaluation focuses on a single class or an entire room, or on the learning experience of one patient versus all patients learning a certain skill. The scope is influenced by the evaluation's purpose and available resources. So dito sa scope is nakadepende siya if ang iyong scope na tuturuan is an individual or a group. Sabi din dito na it addresses questions like whether the evaluation focuses on a single class or an entire program. Because nakadepende sa kung gaano kadami ang iyong audience to know kung paano mo i-handle or kung paano ka mag-teach sa kanila. Next is the resources. The resources of an evaluation encompasses time, expertise, personnel, materials, equipment, and facilities. It's essential to realistically assess available resources relative to what needed for the evaluation. Time and expertise are particularly crucial for data collection, analysis, interpretation, and reporting of result. Conducting a thorough evaluation requires adequate allocation of these resources. Ang sa resources is it encompasses time, because if you have resources on hand, you will save time for more things than expertise, personnel, materials, equipment, and facilities. Kailangan ito para ma-assess kung ano yung available resources na needed para sa evaluation. Because kung meron ka, kung kumpleto ang gamit mo para sa iyong evaluation, makakasave ka ng time and effort sa paggawa ng evaluation. Then sabi din na ang time and expertise ay ang crucial para sa data collection, analysis, interpretation, and report of results. Because conducting a thorough evaluation, kailangan daw nito ng adequate allocation ng resources.
So now we have the evaluation model, the Roberta Streisel Abruzese or RSA evaluation model, developed in 1978 that categorizes educational evaluation into different levels. It is initially designed for staff development education, but still remains useful for conceptualizing types of evaluation from both staff development and patient education perspectives. So, the RSA model visualizes 5 types of evaluation based on focus, purpose, related questions, scope, and resources. It includes the process evaluation, content evaluation, outcome evaluation, impact evaluation, and a total program evaluation. The first type of evaluation is a process formative evaluation. It aims to promptly identify and implement necessary adjustments to educational activities, such as personnel, materials, facilities, teaching methods, learning objectives, and educators' attitude. A component of the ongoing education cycle of assessment, planning, and implementation. It helps the nurse anticipate and prevent problems before they occur and identify problems as they arise. Next is content evaluation. This is to determine whether learners have acquired the knowledge or skills taught during the learning process or learning experience. This is to focus on how the teaching learning process affected immediate, short-term outcomes. Abruzese, 1992, described content evaluation as taking place immediately after the learning experience to answer the guiding question such as, to what degree did the learners learn what they were taught? And to what degree did the learners achieve preset behavioral objectives? Now is the outcome or summative evaluation. The purpose of outcome evaluation is to determine what the effects of teaching efforts. It measures the changes that result from teaching and learning. This type of evaluation summarizes what happened based on the education intervention. Guiding questions in outcome evaluation include the following. Was teaching appropriate? Did the individuals learn? Were behavioral objectives met? Did the patient who learned a skill before discharge use that skill correctly once home? Or did the student nurse who acquired a new skill in a laboratory setting? Now is the impact evaluation. The purposes of impact evaluation are to determine the relative effects of education on the institution or the community, to obtain information that will help decide whether continuing an educational activity is worth its cost, according to Adams 2010. Example of questions appropriate for impact evaluation include: what is the effect of an orientation program on subsequent nursing staff turnover? And what is the effect of a cardiac discharge teaching program on the long-term frequency of rehospitalization among patients who have completed the program? Now is the total program evaluation. This is to determine the extent to which all activities for an entire department or program over a specified time meet or exceed the goals originally established. Goals for the department or program are based on goals for the larger organization, according to Desilets 2010. General scope of program evaluation is broad, generally focusing on overall goals rather than on a specific learning objectives. The guide questions were: to what extent did programs undertaken by members of the Nursing Staff Development Department during the year accomplish annual goals established by the department? And how well did patient education activities implemented throughout the year meet annual goals established for the institution's patient education program?
Designing the evaluation. Nurse educators should design evaluations within established frameworks and boundaries. The design must align with the purpose, question, and scope of the evaluation. In designing the evaluation, it should be realistic considering the availability of resources. Kailangan yung design ng evaluation mo is within sa scope lang ng kung ano ang meron ka. Next is evaluating design includes 3 interrelated components. First is yung structure, kung paano mo i-construct or paano yung design ng iyong evaluation. Next is yung methods, kung anong method yung gigamit mo sa paggawa ng design sa evaluation. Then last is yung instruments used mo to help you design the evaluation. Then next is evaluation design should be detailed and rigorous, meaning it should be precise, exact, and logically organized. So in designing the evaluation, kailangan ang design mo is hindi siya crowded. Kailangan precise ang ginapahiwatig mo na idea and organized siya. The next is all evaluations should be systematic, carefully, and thoroughly planned before conducted. Sabi dito na lahat daw ng evaluation is systematic. By meaning systematic, it's sunod-sunod in a organized way. Sunod is carefully and thoroughly planned. Kailangan planado before ka mag-evaluate. Planado siya before mo gawin para kapag mag-evaluate ka is okay na. The rigor of the design depends on the questions to be answered, the complexity of the evaluation, scope, and how the result will be used. So, all evaluation will depend on the question to be answered. Kung ano yung question na gisagot nila, yun lang yung ma-evaluate mo. Then, yung complexity ng evaluation scope. Then, kung ano yung result or yung outcome na magagamit. Then next is evaluations addressing cause and effects or having broad-reaching and critical results require more complex and structured design. Sabi dito na ang evaluation na nag-a-address sa topic ay sa may cause and effect or yung may mga broad-reaching and critical results, mas kailangan nila ng more complex and structured designs since ang topic nila is more complex and need more detailed evaluating.
Good day, everyone. My name is Gemma Salvano, and this is the continuation of evaluating a health education plan. So we proceed on the evaluation method. The focus of evaluation determines the structure of the evaluation design. The design structure determines the key methods used to collect the data. Its purpose is to assess the effectiveness, efficiency, and impact ng kinakonduct natin na process or project. Through this, makakagather tayo ng data para malaman if the objectives are met, and as well as para malaman ang mga strengths and weaknesses. Now, here we have key questions para makapili ng effective evaluation methods. First is which type of data will be collected. Now, healthcare education evaluation involves gathering data on people, programs, and environments essential for various evaluations like process outcome and impact assessment. The data gathered from individuals or the other processes, important siya para maka-evaluate tayo. For example, data like patient satisfaction. Now, this data magagamit ito para maka-evaluate or para ma-evaluate if the action given or the intervention is effective. Next is people data encompasses demographics and behaviors, while program data includes cost, length, and teaching method. There are two types of data, the people data and the program data. People data, these are data from the individuals involved in the process or the program na nakabase sa age, gender, ethnicity, behaviors, and such. while program data includes the details of the program. This includes mga gastos, duration ng program, and mga teaching methods. Next, decision-making for data collection is guided by the need to answer evaluation questions effectively. Meaning, when deciding how to collect data from an evaluation, the choices are made based on what information is needed. This is to effectively answer the evaluation questions. Data can be quantitative numbers or qualitative numbers. This is very clear. Quantitative means the data is more on numerical. This includes percentage, and qualitative is more on subjective datas, feelings, and behavior. Collecting both types is resource intensive and requires justification based on the evaluation's focus. Gathering people data and the program data is often collected by multiple data collection methods such as tulad ng surveys, interviews, observations, and document reviews. And we must justify why both of the data are necessary for the evaluation if, for example, resources are limited. Another question is, what data to collect and from whom? Data collection comes directly from individuals referred, especially for process evaluation involving all learners and educators, while content and outcome evaluations require data from all learners post-activity. Now, this means that for process evaluation, data collection is from the individuals involved evaluating the process of the program, while the content or outcome evaluation is based on the data of the individuals after the program. It's like a post activity given by the post activity given to the individuals to collect data. Next is sampling might be necessary for impact and total program evaluations due to resource limitations, aiming for representative samples encompassing both participants and non-participants. If limited ang ating resources, by using sampling techniques, makagather ang mga evaluators enough data from a number of people by selecting a number of people as representative from a larger group. Example, pagpili ng 5 evaluators every specific target age group instead of selecting all individuals in a barangay. Next is pre-existing data can be utilized if they align with the evaluation's purpose, definitions, and population of interest. By using a pre-existing data, leverage siya. We leverage existing resources and information na naka-align sa purpose and definition of the evaluation. Next question is how, when, and where to collect data. Data collection methods include observation, interviews, questionnaires, record reviews, and secondary analysis chosen based on data type and available resources. Now, there are various data collection techniques and approaches na pwede magamit para makollect ang mga information needed for the evaluation. However, we must choose based on the type of data that we need and our available resources. Employing multiple methods offers a more comprehensive understanding of the program or performance being evaluated. Means by
meaning by using multiple methods, makaklarify or malalaman natin if the program that is evaluated is effective. Timing of data collection varies. Process evaluation occurs during content evaluation, immediately after, outcome evaluation, post-activity, and impact evaluation is weeks to years later. So process evaluation, it is assessing the implementation of a program or intervention. It examines how the program activities are carried out, by quality of those activities, and whether they are being executed as planned. Content evaluation, this is done after the process evaluation. This assesses the substance and the quality of the materials being evaluated. For example, the clinic's infrastructure and the availability of the internet connection during the program or the process. Next is outcome evaluation. This assesses the results or outcomes of the program, intervention, or the initiative. For example, measuring improvements in patients' adherence to medicine after participating to a program. Next is impact evaluation. This assesses the broader long-term effects of the program, if the intervention has achieved its intended outcomes, and whether it has caused significant changes in target population or environment. For example, a nurse educated a barangay about the negative effects of smoking. After weeks after, the number of people who smokes in the barangay lessens. So that is impact evaluation. The location of data collections significantly influences evaluation results, requiring careful consideration beyond convenience. The location where the evaluators collect data has great impact, or can greatly impact, the representation and the accuracy of the data. For example, if data was collected only in a specific location, then the results may become biased and will not accurately represent the broader population or context being evaluated. Limited resources for home visits can be mitigated by training others to observe and record patient performance rather than relying solely on the evaluator convenience. One way to address when resources are limited for conducting home visits, the evaluators can train individuals such as family members, community health workers to perform observations and record tasks. Next is who collects the data. Educators often collect evaluation data due to their direct interaction with learners. Combining the roles of evaluator and educator is suitable for process evaluation. So this means educators can also be evaluators. This simple as that. Next is a use of external data collectors is not financially viable. Biases can be minimized by limiting the number of collectors and ensuring uniformity. It is not really recommended to use external data collector, especially if they're only limited lang ang budget ng mga educators, because you need to pay them pa, and biases can be minimized by assigning only enough enough collectors can ensure uniformity and mas madali ang pagtrabaho since konting tao lang ang mai-involve during the data collection. Next is nurse educators are expected to be proficient in data collection techniques given the importance of data analytics and electronic health records. Since nurses are known for them being precise and values the importance of data analytics and the use of electronic health records, they are expected to have accurate skills on data collection, especially in analyzing and interpreting the data collected to come up with a sound decision making and improve patient care. Portfolios are increasingly used for evaluation in nursing specialties, serving as evidence of professional development and impact on practice. Nurses portfolios, which contains the professional work, his or her professional works, achievements, and experiences can be used as an evidence for evaluating the nurse's performance, allowing for professional development. Now, the evaluation instrument. Nurse educators should prioritize existing evaluation instruments to save time and resources. It is encouraged for the nurses to evaluate or evaluators to use evaluation tools and instruments that is already existing than creating a new one since by using the old ones, pwede sila makasave ng time and resources. Instruments to use in multiple studies are preferable due to their tested reliability and validity. Selected instruments must precisely measure the defined performance. Here, pwede natin gamitin ang mga assessment tools na nagamit and has already demonstrated reliability and validity. This is because such instruments have undergone a rigorous testing and validation process, reason why mas effective ang ikakandak na evaluation kung gagamitin natin ang mga tools na ito. Lastly, reliability and validity should be confirmed with similar individuals to those from whom data will be collected, meaning the reliability and validity of a method should be tested sa mga individual with the same demographics, characteristics, and target population para makakuha tayo ng accurate findings galing sa ating target group.
The barriers to conducting evaluations in healthcare education includes the lack of clarity, lack of ability, fear of punishment, or loss of self-esteem. Overcoming these barriers requires deliberate effort and strategy from the nurse educators. Lack of clarity. This is where the evaluations become challenging when their focus is not well defined. Ambiguities in the evaluation's purpose and the intended use of its results can impede the process and limit the utility of the findings. So, a challenge due to lack of clarity is unclear objectives. When objectives or goals of the evaluation are not clearly stated, interpreting the evaluation becomes difficult even for experienced evaluators. To mitigate these issues, a clear evaluation focus should incorporate. So, this includes the audience. Their perspective helps in defining key terms and shaping evaluation criteria. Purpose, the reason of the evaluation, the questions. For example, does the patient understands the purpose, dosage, frequency, and side effects of the medications? The scope, assessing both the patient's knowledge and their practical ability to manage medications, and the resources. It could be utilizing the available staff or educational materials. For the second barrier, the lack of ability. Evaluations can be hindered by various barriers, including lack of knowledge, confidence, interest, or resources. Addressing these barriers is crucial to ensuring effective evaluations. The barriers to conducting evaluations are knowledge and confidence gaps, lack of interest, and insufficient resources. Evaluators may lack the necessary knowledge or confidence to conduct effective evaluations. There may be a lack of engagement or interests in the evaluation process from those involved, and insufficient resources, such as personnel, equipment, time, facilities, and etc., can impede the evaluation process. The primary audience is responsible for providing these resources. So, overcoming barriers involve expert consultation, where engage external experts through consultations or contracts if the funding allows it. Collaboration, where we work with colleagues or other departments to pool expertise and resources, and conducting a literature review to identify effective evaluation methods and resource equipments. For the last barrier, the fear of punishment or loss of self esteem. Fear of evaluation can significantly impact the effectiveness of assessments. This fear often stems from concerns about being judged or perceived as incompetent, affecting both learners and educators. A manifestation of fear is showing self protective behaviors, which includes the avoiding of participation, provide socially acceptable answers rather than honest ones, and displays anxiety or anger. So, to help overcome the fear, we should acknowledge the fear, clearly communicate the evaluation's purpose to reduce the anxiety and misunderstandings. Next is to emphasize the individual over the performance. Focus on the learning process rather than the outcomes to reduce fears. Next is highlight efforts and achievements, providing genuine praise for effort and accomplishments, focusing on the process and improvement. And last but not the least is privacy and consent. Ensuring privacy and informed consent in the evaluation process according to the ethical and legal standards. So, conducting an evaluation. The successful implementation of evaluations hinges on careful planning and the appropriate selection or development of data collection instruments. However, planning and instrument selection alone does not ensure success. So, in order to enhance the success of the evaluation, we should first conduct a pilot test. Test data collection methods, instruments, and analysis plans with a comparable group. This is to assess the reliability and validity of the new instruments and further evaluate the interpretability and feasibility of the evaluation. Next is include extra time, accommodate unexpected delays during planning, data collection, analysis, and reporting. We should allocate more time than initially anticipated to handle unforeseen issues effectively. And last is maintaining a sense of humor. Preserve a realistic perspective throughout the evaluation process. This is to help cope with negative feelings and is crucial when dealing with audiences that have high expectations for positive results and might hold the evaluator responsible for less favorable outcomes.